Welcome to the Essentra Health podcast series. I'm your host, Yeji Lee. In this series, we bring you helpful information to support your well-being and to overcome the many challenges that life can bring. Our aim is to always bring you information or actions to support your well-being that are accessible to everybody. Today, we are going to be discussing adolescent mental health and tips on how parents or caregivers can support their children's mental health and well-being. Our guest today is Norman Weiniger, Vice President of Clinical Services here at Essentra Health and licensed mental health practitioner with many years of experience working in the mental health field.
Thank you, Yeji. I'm happy to be here and talk about this important topic today.
Thank you, Norman. To start off, could you talk a bit about the prevalence of adolescent mental health challenges?
Certainly. I think, first of all, let's think about how many people that encompasses as adolescents. Nationally, I believe about 1 in 6 people in this country are between the ages of 10 and 19. And for all of us who have been through that experience of being an adolescent, we know there are a lot of physical and emotional and social changes that take place and have to be confronted and worked through. Having said that, adolescence we know is an important period in our lives for developing the social and emotional habits, which kind of become the foundation for our future mental health and well-being. Having said that, there are some studies, I believe, through WHO that show that globally about 1 in 7 people between the ages of 10 and 19 experience some type of mental health condition, yet for the most part, they're largely unrecognized and untreated. So we would like to try to shed some light on that today. I know some of the common mental health disorders, Yeji, among adolescents include anxiety and depression, and that mimics the prevalence of those conditions in adulthood, but also conditions such as attention deficit hyperactivity disorder, ASD or autism spectrum disorder, eating disorders, post-traumatic stress disorders, and even some rare and severe conditions like schizophrenia. Now, emotional disorders such as anxiety and depression, like in adulthood, are common in this age group. For example, I believe the statistics are that 3 to 5% experience anxiety disorders, and 1 to 3% experience some type of diagnosable depressive disorders. On a sad note, according to WHO again, suicide is the 4th leading cause of death in older adolescents. Think about that. The 4th leading cause of death. Now, suicide, Yeji, is not a mental health condition, but suicide is associated frequently with severe depression. So risk factors for suicide in adolescents are several, but they include the harmful use of alcohol or other drugs, being abused in childhood, having stigma against seeking help from others, and barriers to accessing care, and of course, easy access to means of suicide.
Thanks, Norman. For parents or caregivers of adolescents, what are some of the common signs or symptoms that your adolescent may be experiencing some sort of a mental health challenge?
That's a good question, Yeji. I think that the answer is that all the signs and symptoms would relate to noticing changes in behavior, changes in personality, or changes in academic performance, such as prolonged sadness that lasts for 2 or more weeks, for instance. Talk about consideration of harming oneself, having excessive or moody, excuse me, outbursts, changes in eating and sleeping patterns, physical complaints like headaches and repeated headaches and repeated stomach aches, trouble concentrating, engaging in risky or high risk behaviors. And as I said earlier, talking about death and suicide, all of those can be signs or symptoms to notice and to look for. Now, another aspect of that question, Yeji, comes down to the fact that there are multiple factors, as we know, that affect our mental health. And some of those are risk factors. The more risk factors adolescents are exposed to, the greater the potential is on their mental health. And I reviewed some of those risk factors from the WHO research, and they're not surprising. They include growing up in an impoverished environment, experiencing bullying or living in a violent environment or threats of violence, having physical, emotional, or sexual abuse can certainly put one at risk for mental health conditions. Another area is family instability. Yet another is being a member of a group that experiences social discrimination. I think we also alluded earlier to alcohol and drug abuse or misuse are risk factors, as well as chronic illness or some neurodivergent conditions, neurodivergent relating to intellectual disabilities or other neurological conditions that impact our social functioning and well-being. Now, parents and caregivers might not be able to control all of these risk factors, but they do have the ability, Yeji, to notice changes that may occur in their children and to take action when they notice those changes.
Thank you, Norman. I think it's so important for parents to be cognizant of those signs and symptoms and just to understand the impact of those risk factors. Now, kind of going off of that, what are some of the preventative measures as well as other ways that parents can support their children's mental health?
Well, that's another great question, and I think in some ways it relates to how adults can take care of their mental health, because I think the first thing I would say is help children and adolescents to develop healthy sleep patterns. Help them to get into patterns of exercising regularly and being active. Help them to develop coping and problem-solving skills to help with the inevitable challenges we face every day, and to help them cultivate their interpersonal skills and their ability to engage in a thoughtful and caring way with other individuals, and of course help them to learn about their emotions and to manage their emotions. Some other things to think about for parents is identifying some of the items that we just talked about that might be warning signs possibly, and responding to them early on before they become prolonged or severe. I think another tip, Yeji, for parents of adolescents during that very challenging period of life is developing open communications with the teenager, communications about their feeling, having honest conversations with them, to help them feel seen and heard and respected as they navigate through this time of strong or sometimes overwhelming emotions. I think an important tip I would share would be to encourage teenagers and children to be aware of their emotions in stillness, and promoting activities around stillness, such as meditating and having quiet time, making time for creative or artistic activities or reading activities, as well as engaging in more active physical pursuits such as sports. Other kinds of activities that I think are preventative in nature would be to encourage, depending on the child, of course, things like journaling, coloring, practicing breathing exercises to manage stress. I think all of those are healthy habits to cultivate. Maybe one or more of those would fit the adolescent that you have in mind. And speaking of preventative measures, I would just encourage people to know that it's important to think about and support your children's mental health. That your employee assistance program is a great way to get started if you'd like to consult with a professional about that topic, as well as speaking with your school's social workers or counselors.
Thank you, Norman. This is all very important information, and I'm sure everyone learned a lot today. Mental health is an important part of our well-being and even more important for the developing minds of adolescents. So I hope this podcast provides some helpful information for parents and caregivers. And with that, we conclude today's podcast. On behalf of everyone here at Essentra Health, thank you for listening.